for joining. On behalf of Naomi Baylor and Arista Janji, members of the UCSF Decolonizing Global Health Working Group, I want to welcome all of you to today's session. As we've stated on previous seminars, the goal of these sessions is to explore how and why global health needs to change by asking hard questions about the work that we do, how we're funded, the extent to which our research, education, and programs perpetuate coloniality rather than advancing authentic health equity. Over the last 9 months, we've been inviting brilliant, critical thinkers to help us ask hard questions about our community. How does coloniality still manifest at the global level in terms of governance and funding? How does global health research and programs perpetuate asymmetries and inequities in health? And importantly, for the University of California, how do academic institutions address the impact of colonization in the work that we do, both globally and locally? And in that context, I guess I want to start this morning by specifically acknowledging that the land that the University of California resides on has been the home of different indigenous peoples for thousands of years. Here in San Francisco, the original people are the Ohlone people, and I want to express my gratitude and respect to be here today on their traditional lands. And recognizing that the Ohlone people are alive and flourishing here in San Francisco and the broader Bay Area community. However, there is more that the university can still do to address past wrongs and heal the traumas caused by how coloniality here in California and globally has impacted different communities. And we hope that this session and this group can be an opportunity to explore new models for global health praxis, research, and education that ensure more equitable anti-colonial practices. And it's in that context that I'm really delighted to introduce Lance Louskieter to speak with you. But before I introduce them, a brief reminder on the format for these sessions. Our invited guest will have 30 minutes to present their thoughts and insights, and then we want to make this as discursive as possible. My colleague Arista will be moderating questions in the second half of the session, so feel free to tag Arista in the chat if you have a question or a comment for Lance. But let me begin by introducing Lance Louskieter to you. It's, I think, 7 p.m. in Cape Town, so good evening, Lance. Lance is a health researcher and a health systems policy researcher and a queer decolonial scholar and activist. They are currentently a PhD candidate and an Atlantic Fellow for Health Equity. Lance was also named as an emerging voice for global health in 2020, and Lance's advocacy includes partnering with Sex Workers Education and Advocacy Taskforce, or SWET, and serving as a board member of the Sexual and Reproductive Justice Coalition in South Africa, where they champion for the rights, access, and implementation of sexual and reproductive health, justice for sex workers, queer people, and other marginalized peoples. Lance has also participated and continues to contribute to local, national, and global advocacy and research spaces, including at the global level, the United Nations, in San Francisco, in South Africa with the Department of Social Development, and at the University of Cape Town as part of the Health Policy and Research Division. As it's relevant to today's session, Lance is also a researcher who is thinking critically about global health in general from the vantage point of Africa, and also with the perspective of a policy researcher and researcher who's interested in queer and LGBTQI health and health rights, health equity, social and reproductive health justice, intersectionality, and primary healthcare. Lance, we are delighted to have you here today. Good evening and welcome.
Thank you so much, Mike, and hello, everyone. It is really an honor and privilege to be speaking to your community. Thank you for that generous introduction. Can I share my screen, Mike? Is that okay?
Yes, you can. Please go ahead. Arista, maybe if we can give Lance the rights to share his screen. Perfect.
Thank you so much for just laying kind of the foundation. And I wanted to just, I guess, pose that I'm no expert in the area of decoloniality. I am merely a theorist who is interested in thinking about this work and thinking critically, obviously being positioned within the, I guess, the sphere of global health. And in South Africa, we call it public health intentionally, and that's politically because of the history of global health and our critical orientation to global health. I think with this conversation, and I know with a community like yours, you've had different inputs into this particular kind of conceptualization, but also some of the inputs into how does decoloniality or decolonial thinking help us with the praxis, with how do we do decoloniality. And so for me, yeah, I'm offering kind of key insights and starting points for a conversation that will hopefully be useful to you as a community, but also as individuals in deepening your reflexivity in this work, in the ways that you are positioned in this field, but also to help us to build solidarity in this work and think collectively about how to deepen the calls for decolonizing global health, which is also very contested. I work with the African Health Futures Collective, and I have a couple of colleagues. We do this work, and we artists, theorists, practitioners, poets, songwriters, all collectively positioned in Africa on the continent from different parts of the continent, making, I guess, Africa the locus of enunciation of this work, which I think is very important as a post-colonial setting, geographical space. So I think it is very important that I come with that subjectivity, obviously with the recognition of South Africa being a colonizer within themselves, in the sense that we also colonized as a country. And so we carry that. We at the time colonized Namibia, now called Namibia. At the time it was called Southwest Africa, and also recognizing the neo-imperialism that South Africa has been part of in history and also currently. So there's a clear recognition of how complicit South Africa is, and how South Africa comes with a lot of its evils as part of the colonial project. But I guess what I'm trying to get us to think about in this lecture, and I'm going to present a couple of ideas and hope that we can have a conversation. And I know that an hour is very short. But I wanted for us to think about the colonial history and move into a space and offer a framework by Sabelo Ndlovu Gacheni, which some of you might have read and engaged with, who is a Zimbabwean decolonial scholar and theorist, in thinking about the manifestations of colonization or coloniality today. So kind of clarifying some of the concepts, and I'm sure some of you are familiar with these clarifications or these conceptualizations, but I think it is important, especially when we are starting off. So I don't know where we all at in this conversation, but I'll kind of start from kind of the onset of my own thinking and my own ideas. I'm also recognizing, I think, just from that my mountains greet your mountains and my seas greet your seas, and it's important for us to to think as that we are a collective and a critical consciousness project. The Decolonial project is about a deep awareness of indigeneity, and I think it is, and part of that reclamation of indigenous ways of being and doing is also the understanding that we exist in an ecosystem, and acknowledging that as human beings we coexist with the land that we have been blessed on, and we should acknowledge it, we should recognize it, and it is part of who we are. And so I just want to acknowledge the land that I'm standing on. I acknowledge my forefathers and my ancestors. And so I draw on their wisdom and their perspective in guiding me in this venture of knowledge and ideas that I'm sharing with you. I think for the first part of this, and I think for when I use the notion of critical orientation in global health, is really naming the way in which the colonial relationship has been constructed in history. And that is really that global health needs to be understood and located within this history. And that's important, because it's only if we historicize and politicize global health is that we are able to think about how to develop decolonial and justice-driven responses in addressing the issues that we are dealing with. And particularly issues linked to oppressive power and structural power. And so for me, understanding the critical orientation of global health is to understand the relationship of power between the colonizer, which is the colonial systems, the representations of people, places, and spaces, hegemonic systems of dominance and subjugation, and the centers of power and the health system. And I think what I mean is that I've been quite critical. So I'm at the University of Cape Town, and the University of Cape Town is one of the key spaces in South Africa. It's a university of tertiary education, just like your institution is. And I suppose what is significant about the University of Cape Town and many other universities is that it is part of the colonial project, in the sense that these institutions were created to study Black subjects as inferior, and to be able to reinforce and legitimize why the colonial project was important in the civilization project. And so it is fundamental that we understand it that way. We also need to be honest about the health system and health in the history that has been linked to saviorship, white saviorship in particular, and that it has also been linked to a history of, tropical medicine, which was really to build health infrastructure to be able to develop solutions and ideas for why so many colonizers were dying in post-colonial spaces or contexts like Africa. And then, so this is part of the history. So for me, I am quite critical of the University of Cape Town and the health system being colonial institutions. And so I name it as such. And so there's a relationship between the colonizer, these colonial institutions, and the colonized. And these are communities, cultures, indigenous communities in particular, Black communities and Black subjectivities in our context. And the beliefs, the practices, the knowledges, and how, the ways in which and I'll speak a little bit more about this when I speak about the organizing principles. And these are the particular kind of structures that were created, or the principles that were created, that defined the global imperial design project, and race and gender and heteropatriarchy being part of those organizing principles. And so a critical orientation is also seeking to understand the relationships of dominance and or of resistance within a framework that foregrounds politics, power, and positionality. And I'll speak a little bit about that as we go along. And that we need to be able to understand politics and power and the ways in which it plays out in health systems across different contexts. But particularly in post-colonial contexts, like in South Africa, I mean, we live in a settler colony. And the reason why I say that is because majority of the South African population is Black. And yet the economic power is in the white minority in South Africa. So many, much of the economic, political, and land resources is still very much owned by white people in South Africa. And so, and the Black majority live in particularly difficult circumstances and live very undignified lives. And I'll connect the issues of race, obviously, when I introduce the intersectionality framework as part of the decolonial framework. And I think my argument is that it is critical, it's important. To reflect on intersectionality theory, and intersectionality theory, of course, emerged from the African feminist movement in the United States, particularly North America. Yeah, and that's what I'm hoping to do a bit later. Let me just move to the next slide. So, for us to understand coloniality, I think it is important for us to understand and name colonization, and I think for many of you who are identifying yourselves as decolonial scholars or decolonial thinkers or people wanting to do this work, constantly need to reflect back to this moment in history, an important moment in history that's synonymous to slavery, war, genocide. And we constantly have to think back to all the kind of inherent trauma in the processes of colonization and colonialism. And so colonialism is a very complex power structure that really transformed the way people lived. And it was the invention of this asymmetrical and colonial intersubjective relationship between colonizers, including colonial institutions, and the colonized subject. And that's quite important because even in contexts like South Africa today, the health system is a very alienating space for many Black people, many queer people in this, and it's mainly because of these colonial organizing principles. Colonialism is a practice of domination, and I think that's important, that it was intended to be a subjugation project, a dispossession project of one people to another. And it also economically instituted dispossession and the transfer of economic resources from those who were indigenous to those who were conquering and foreign. And it also claimed to be a civilizing project, and it hid its sinister motives, where the civilizing mission, which suggested that a temporary period of political dependence or tutelage was necessary in order for the uncivilized societies to advance to the point where they were capable of sustaining liberal institutions and self-governance. And I think this is an important conversation especially in the development sector. And we can have that conversation, but I think that many of you who are interested in issues of development will know this to be the case, that it's also in this kind of languaging and discourses around third world countries, low and middle income countries, which is often languaging that we always adopt, but are never very critical of. And so it becomes very important for us to situate that languaging within this colonial history. The colonial project also included practices of domination and dispossession of land, customs and traditional histories, knowledge and value systems. And it's also about this ways of being and doing, and it's through the epistemic, epistemicides, which was the destruction of indigenous and African knowledge in our context. It's the imposition of colonial language into the different systems and institutions is mandatory, and then also the ways in which the vilification of indigenous knowledge and indigenous ways of being and doing that were demonized or seen as witchcraft, etc., within these contexts. So decolonization then, so we understand the period of colonization. Then decolonization was really describes the process to which the direct colonial rule was withdrawn. But it's imperative to understand that decolonization did not automatically remove the effects of colonial oppression. And so for those who have read Gross-Fugel will know that, will be familiar with this quote, that one of the most powerful myths of the 20th century was the notion that the elimination of colonial administrations amounted to the decolonization of the world. And so it's this heterogeneous and multiple global structures that were put in place over 450 years did not automatically evaporate when kind of the juridical and or political decolonization of the periphery over the past 50 years. And in South Africa, we got our independence in 1940, but we did not go into an independent state. And that's why we don't have Independence Day, we have Freedom Day, because of course we then became the apartheid state in 1940, which was also a white supremacist government, a consequence of colonization and the colonial project that kind of continued in a neo-colonial form. But it is critical that we as global health, as practitioners, as scholars, as activists, understand that we exist in this colonial matrix of power. And so what is this colonial matrix of power? What is coloniality? Coloniality is the condition that survives beyond the period of colonization. And today, we see the ubiquitous and very nuanced ways in which systems of oppressive power continue to reinforce and perpetuate themselves. And I think that's why we are having this conversation, right? We wouldn't have had this conversation and be a collective such as yourself, a community such as yourself, if this wasn't the case, if we didn't see the ways in which the colonial project manifests itself and reproduces itself. But also in our psyches, right? And coming into this space, I acknowledge that I too have been colonized, and part of that understanding that I've been colonized requires me to step into a space of a process. That the decolonial project is a process. It's a means to an end rather than the end within itself, and I think that's quite important. And I'll speak to that a little bit more later. And so coloniality is the invisible power structure that sustains colonial relations of exploitation and domination long after the end of direct colonization. And as modern subjects, we breathe coloniality all the time and every day. And through globalization, modernization, and different forms of kind of neo-structures that are put in place, we see the manifestation of coloniality. And within a medicalized frame, coloniality is the diagnosis. It's the analysis of the problems of the world, the wicked problems of the world in particular, problems that are very difficult to address. We find ourselves constantly finding programmatic interventions to these problems, but end up quite limited because the changes that we see, the structural changes that we need to see does not happen because our analysis of the problem is not targeted at the structures that needs to shift and transform. And so the colonial matrix of power is based on the organizing principles I spoke about earlier on, which is right. And for this conversation, I just limit it to this because I only have an hour, and it's this racism, heteropatriarchy, and capitalism. Well, I have under an hour. So the colonial matrix of power are kind of the organizing principles of colonization, and some of you might be familiar with these. They intersect with each other and they enable coloniality to reproduce itself. And they build on power asymmetries in all areas of life. But also, very importantly, is that it results in economic dispossession, that the ways in which the world is organized based on these structures, based on people's subjectivities, and the ways in which people identify themselves, these are important in framing people's subjectivities, people's positionalities, people's access to health. But more importantly, it also frames the way in which we both understand the problems that we face in global health, but also frames the sorts of solutions or the way we think about addressing the problems that we're engaging with. So it's the question of who gets to define what the problems are, who gets to sit at the table of decision-making and deciding what resources is allocated to the people addressing the problem, etc. And then these particular organizing principles form part of the structural determinants of health. And there's an amazing framework that we don't often teach, but it's such an important frame. It's linked to the social determinants of health, but the Pan-Americans, or I think it's a Pan-African Health Organization, Equity Commission, designed and endorsed in 2010 this framework for the Equity Commission, and it really placed emphasis on structural racism, colonialism, and the importance of the relationships with land and the relationships to land. And there was greater emphasis here on environment and climate change. But the focus really is on the understanding of structural drivers being central to determining the conditions of daily lives. And that, in essence, will create or foster health equity and dignified lives. And also the structural drivers and the conditions of life is the spaces for taking action, for mobilizing action around addressing health equity and these structural determinants of health. And I think this is an important framework because not only does it explicitly focus on human rights and the greater inequities based on those organizing principles I've raised, race, gender, ethnicity, sexual orientation, life stage, and disability, but also there's a clear recognition of the relationships between these organizing principles with an emphasis on leading dignified lives as a desired outcome, instead of merely just focusing on targets and particular kind of health outcomes in the kind of traditional global health space. And so it is important in our reflections about these organizing principles is that we come to the intersectionality framework, that it becomes part of the understanding that, and I won't go into the history of the intersectionality framework. I mean, it comes with a particular kind of African feminist perspective, but it's of critical importance that we understand that the ways in which structural determinants intersect to create the conditions for individuals and communities. And so it is of critical importance that structures and positionality is part of the ways that we think about justice-driven responses. And so what is decoloniality and what's the understanding of decoloniality that we as a collective propose? And yeah, I speak from the African Health Futures Collective, but also some of my own theorization, is that decoloniality is a political an epistemological, but also an economic liberation project aimed at dislodging coloniality and its manifestations. And so it's important that we understand, that we ask ourselves, what is it that we are dislodging from? What is it that we are delinking from? What are we disrupting? And in that process, that we do not limit our efforts and only define ourselves within the efforts to disrupt. That what is the space that we need to move into in order to create, to build, to reclaim, to reckon? What is it that is required from us? And that decoloniality is a practice, an ongoing project. It's about the ways of doing and being in the world. And so us as the African Health Futures Collective sees decoloniality as a conscientization project. It's a mind project, and I referenced Steve Biko, which is who is an important theorist, and Ngugi wa Thiong'o, who both are theorists and important scholars that have really got us to think about the deepened conscientization project, the political project, and a deep reflexivity project. And so the decolonial turn is a project that aims to epistemological transcend, that decolonize the Western canon and the epistemology. And Audre Lorde speaks about that you cannot find the solutions to dismantle you cannot use the tools of the master's house to dismantle the master's house, that we need to look outside of the canon. We need to be able to understand that the only way in which we can understand and be critical of ourselves within this master's house is that we'll always be only in service to the master's house if we're not able to look beyond it. And so for folks like me in global health, like us, and in academic higher educations who carry a particular colonial history, it's constantly the question of, what am I in service to, and how am I? What is required for me to dismantle coloniality within these systems? But it also calls for and I think just for the epistemological project, the knowledge project, it is important that we understand knowledge, the knowledge production, the episteme, the epistemic, as an ecosystem, that we understand that the alternative ways of knowing and being in the world that should be embraced, that Western knowledge is not the only forms of knowledge. And actually we've seen with the COVID pandemic, the ways in which Western knowledge and Western scientific knowledge had posed a lot of limitations. And we found that actually it was in spaces that transcended only a particular kind of knowing where we've seen success. And here in South Africa, particularly where we've seen collective and indigenous ways of being and doing have yielded a lot of success for health outcomes and protection for COVID. And alternative ways, and so as part of this kind of recognition of alternative knowledges is also reopening the vistas of liberation from global imperial designs and colonial matrices of power. And so this is, I'm just checking on time, Mike. Do you mind just giving me a quick time check for when I can conclude? How much minutes?
Maybe another 5-7 minutes. How does that sound?
Okay, that's great.
Thanks.
So I think I'll end with this slide. I have a lot more, but I can share with folks. So for us, we argue that I think what is important in this kind of decolonial, anti-racist, intersectional lens, and that frames our critical orientation, we argue that the history of the health system is rooted in racist and sexist colonialist ideologies and the colonial project. And so it is important to ask ourselves, how does the past live in the present moment? From your positionality as a health worker, a researcher, an academic, a policymaker, etc. We need to develop a systemic structural understanding of how the organizing principles of coloniality are entrenched in global health and for us public health. it's a long haul. There's no magic silver bullet. And I suppose in global health, it's always the magic silver bullet that's always emphasized as the kind of way in which we need to understand addressing the issues or the crises of the world. And we act to disrupt interlocking forces of coloniality and the inequalities or the social gradients and deprivation. And so what does disruption of the matrix of power mean for you, right? For us, and for how we provide care, for how we understand our research, for how do we see our role in society? And I think that's quite important. And so we develop, sorry, I'm just checking, there's a chat, I'm just seeing, okay. Oh, that's something else. So we developed a practice of reflexivity, examining our own behaviors and practices. And it's about this understanding of how we knowingly and unknowingly reproduce practices in our ways of being and doing. How do we reproduce colonial practices in our ways of doing and being? I think I'll stop there, Mike, and then I'll just pick up on a lot more of these. What I did before I stop, what I think I should do is introduce Ndlovu Gacheni's framework, and this is quite important. So the coloniality of power, the coloniality of knowledge, and the coloniality of being are three, I guess, domains that Ndlovu Gacheni gets us to think about in terms of the manifestations of coloniality. And for the coloniality of power, it is the technologies of domination, control, and exploitation. It's the institutions, the healthcare systems, the universities, the schools who also form part of these technologies of power. It's the legacies of these institutions and the structural violence that it imposes. But it's also the way in which economic power, land ownership, the privatization of healthcare, etc., plays themselves out. The coloniality of knowledge being the domination of over knowledge, the production, who produces knowledge? How do we produce knowledge? Who consumes knowledge? The carry of ideology, discrimination, the inherent biases, the medical doctor versus the community health worker, these kind of hierarchies in health systems, but also the relationships between providers and patients, with the principal agent responses. And finally, the coloniality of being. And this is really about the denial of humanity, the processes of inferiorization and dehumanization. And there are so many examples of this, especially in in North America, where we've seen with the Black Lives Matter movement, some of the calls, the othering of colonized people compared to white subjects, and how does it feel to be historically excluded, the using of agency and also racialized, gendered, and queer encounterings. Yeah, I think I'll pause there. Thanks.
Thanks, Lance. I'm going to hand over to my colleague Arista in a second, who's going to moderate the next section. Very illuminating talk and lots of issues raised. I hope you don't mind me jumping in with a question just to start off this session of discussion. But I love this notion that where you've taken Audre Lorde's the master's house concept and applied it to global health, and that idea that you can't dismantle the master's house with the master's tools. So if we're thinking the global health embodies and perpetuates colonial ideas and traditions, reimagining global health means using a different set of tools. What are those tools? Love to get your perspective on how do we do that? What does that look like? And then I'll segue over to Arista when you've answered.
Yeah, Mike, and that's the difficult part, especially when we are. I mean, like I said, like the Western canon is ubiquitous, and it's really the kind of the Western European and North American approach. I mean, in South Africa, we are very intentional, first of all, about understanding like on the kind of epistemological, the paradigm continuum. understanding that, you know, the social sciences has been an important process for that, for acknowledging critical constructivist theories. But more importantly, shifting it a little bit forward and saying that actually, for us, our indigenous knowledge is important. And so part of my personal process has been to do work with indigenous healers, to be able to learn, listen, reflect, and think about a lot of those knowledges that have been delegitimized by myself in my training, but has been so central to the work. So going to my great-grandmother, to my grandmother's knowledges, to my grandfather's knowledges, being able to call on the birth attendants in our work, and really going to the communities and trying to legitimize their work. And they're doing incredible work. That is not just, I guess it's not part of the canon. Yeah, but I have a longer response to the question about where to look for, but I think I'll keep it there for now.
Thank you so much, Lance, for your presentation and for joining us today. I think a lot of us may have heard of intersectionality and the intersectional approach, but not how it applies to decolonizing global health. So that was really interesting to consider and hear about. It looks like we have a hand raised from Sean Wanzo. Sean, would you like to ask your question?
Yes, thank you, Arista. Thank you for keeping me connected. Hi, Lance.
Yeah,
I do diversity, equity, inclusion work, or, whatever acronym, you choose to use, EDI. There's many of them, mix the letters up. And I'm really hypersensitive when it comes to, matters of decolonization, diversity, equity, and inclusion. Just watching a news story last night about Malcolm X's suspected murders being released, that brought tears to my eyes. My question is, doing the work that I've done, I found, and I've always had an interest in environmental, global health, environmental justice, global health as well. So I was just wondering, doing the work that you do and doing the research you do you run into the same challenge, when it comes to decolonization work and, health equity, more specific to your work, the balance between recognizing, the traumas, that certain factions of the white community, more particularly white women, have been through, because they are a historically marginalized group. Do you run in, and I found that as I move through the work, that's been my balance, like not dismissing, anybody's, lived experience, while trying to work with them or work for them. Do you find that same kind of challenge and balance within the work you do, within the global health space?
That's a very important question, Sean. And I think that, so thank you for that. And let me first start by acknowledging that trauma that you spoke about, linked to the impacts of the ways in which our historical trauma comes up in different spaces, and the implications that it have on us and our psyches. So I just wanted to first of all acknowledge that, and thank you for that reflection. I suppose that, to come back to addressing your question, for me, what has helped me is to ask myself, in relation to positionality and intersectionality, and I think this is where intersectionality becomes important. So it's not oppression Olympics, and I think that is fundamental. That's key. So it's also about understanding that black subjectivity is not white subjectivity. It's very different. the subjectivity of women is not the subjectivity of men. And the subjectivity of white men is not the subjectivity of Black men. But it's also to be able to understand that inevitably all oppressions are connected. And I think that's that. And if you're not able to step into that conversation with love, humility, and I suppose the inherent forgiveness for the mistakes that folks would make, because there are many mistakes that I make as a male body, even if I am gender non-conforming and queer. And the same, I suppose, the same love and the same, I suppose, grace, really, that I expect is the same grace that I suppose, so that I would want to show. But at the same time, accountability is important. So how do we navigate the accountability? I think that's the difficult part, because accountability in action is very difficult, especially when the lack of understanding of what the issue is, and the ways in which I suppose the weaponization that takes place, and these different ways in which we struggle with privilege and power. So I guess there's no easy answer, but for me, what has been helpful is to be able to show and affirm that same sense of grace that I expect in feminist spaces, for example, to listen, to learn, to reflect, but also to be able to hold folks accountable. And also to be able to name what the issues are. And I think that's the power of languaging and theorization and conscientization, is to be able to hold on, pause. You see, this, what you're doing right now, this reflects exactly what's happening in society. And I can't sit here when the same violence is being perpetuated in this particular space. I think we really struggled with that in the fallist movements, in the student movements, when I was part of it in 2016, is because there were trans folks who were feeling like cis folks and men in particular were violent to them. Black women were completely excluded from the movement. Black men were violent in so many ways. Difficult, especially when you think about whose issues are being centered, whose oppression is being foregrounded, and at the expense of what and of who. But we can have a long conversation about that.
Yeah, and I definitely don't want to take up all the time, because I assume there's more questions, but I just want to end with, not really in response, but like to keep it going a little bit, to piggyback, doing this work, it's like, I hate to put it like this, you kind of catch it from all sides, because it's like, a lot of my colleagues and peers, I'm a Black and Latinx male, so they want you like, hey, your work is centering too much on, you kind of got off topic. You're focusing too much on indigenous communities and things like that, or the Asian community. And I'm like, okay, I understand that everybody needs to focus on their own community, but we're only gonna change systems and create adjacent systems, by unifying. And the only way we're going to unify is we have to start connecting the work. And there has to be people that, even if they're only concentrating on their community, somebody's got to reach out. It's got to start somewhere. So thank you. And thank you.
And that's the Solidarity Project, Sean, that what happens in what the Black Lives Matter movement have shown and reflected to us in building solidarity with our project here, where folks in South Africa were going to the consulate in solidarity to the Black Lives Matter movement. So the Decolonial project to me is a solidarity project across different issues, but I also recognize that that we need to build collective spaces, and we also need to give people space and time for those subjectivities that need that space, because we don't have spaces. And so just to have a space for Black people to just be is important. Just to have a space for queer people to just be is important. But we need to constantly be connected. And so, yeah, you make a really good point. What does solidarity look like? And I suppose that's the big question. And especially in global health, because I think we struggle in global health to build solidarity. Thanks, Sean. Thanks so much for that engagement. Any other questions? First,
Thank you, Sean and Lance, for that great response. I think it goes back to that quote that I can't remember the origin of, but we're not free till we're all free. It really highlights that. I think we can maybe do one more question. I think the irony of this speaker series and this session in particular is that we're talking about decolonial systems and decolonizing global health in a university that's situated in the global north, quote unquote, and North America. And so, it might be seen as an attempt at virtue signaling, or, at worst, a corruption of what decolonizing global health should actually look like. So would you have any guidance or advice for, researchers and academics on this call who are situated at the University of California, San Francisco? What is our role, and how can we contribute to, centering the voices of others who are based in countries that have experienced colonization?
Yeah, always met with that question. It's kind of, and I suppose that our work as the African Health Futures Project really stemmed from a deep frustration, actually, with the ways in which I suppose the decolonial or decolonizing language have been kind of co-opted and became a buzzword in many spaces. And just the frustration with no acknowledgement of the theorists and folks who have, like, not locating that conversation in the history of so many African theorists, African feminist theorists. I mean, Stella Nyanzi, there are so many that I can, Amina Mama, Mahmoud Mamdani, and also South American theorists that we draw on significantly. Grasfugal, there are so many, Maldonado Torres. So there are so many key people, Paulo Freire as well. So there are so many key people that that is completely kind of removed. So I think an important part of this conversation is acknowledging that in these post-colonial settings, this knowledge exists. This is, and part of it is acknowledging those theorists, acknowledging people and folks who are doing this work, who's theorizing around this work. And I think who do we read is central to the Colonial Project, because who we read informs how we think and shape this conversation. I also think that it's important that we think about the ways in which coloniality manifests within your own settings and in your own conversations. And I think that Sean picked up on some of those things, and many of you are located within spaces where you're able to name the kinds of manifestations of coloniality. But it's also important, it's equally important to think about the way we reproduce. And sometimes we have to reproduce this history. It's complex, because to me, I need to publish for my own survival, right? And I need to publish. So what decisions do I make? Do I need to publish in the Lancet in order to become a legitimate scholar, even in this area of work? But yet, that journal, excludes so many of the people and the communities and some of the important people that I want to be in conversation with in relation to this particular kinds of issues. So who gets excluded? Publication for what? What research for what? And that's quite important. And so we need to think about, even in our policymaking processes and the practices in our systems and in our advocacy, Who are we foregrounding? I think what's also of critical importance, and I'll read you a quote by two folks here at the University of Cape Town who are both post-colonial feminist scholars, Shosi Kesi and Floretta Bunzaya, is that they say that they pose that we as researchers cannot deliver the solutions to the problems of the oppressed, but we can assist people in the process of achieving the changes that they seek. And so community partners and marginal communities are actually the experts on their own lives and are the most knowledgeable about the challenges they face and the aspects of the daily lives that need to change. And so when we come into space, I think this is also issues in global health, is that we constantly center ourselves as the experts within the solutions that we're trying to address in communities. And so, and especially in a very technicist ways. And so we need to be able to reflect and think about how we come into conversation and the ways in which, and so there are some questions that I'd like to pose that could help us think about the work that we do, that I've been reflecting on quite a bit. I'm just looking for the questions that I usually ask myself when I'm doing a project. So first of all, am I the right person to do this work? I constantly ask folks coming in from global North institutions in particular, wanting to have conversations with me. I'm like, why are you the right person to ask these questions in our context? It's kind of, who makes you the right person? And why are you asking this question? From what point in space? What's going to be what's at stake here and for who? And the next set of questions are, if you're focusing on a particular community and you don't have proximity to that experience, how will what you are doing benefit that community? And I mean, these are simple things, right? But we aren't trained to actually flip the ways in which we ask ourselves these questions, right? We come in with particular assumptions that we know best because we've been trained in these prestigious institutions. And so our qualification earns us the right to simply move into a space and decide and predetermine the conditions for these spaces. So that's quite important. And then finally, I think a critical question that I always ask myself is, how do I ensure that the knowledge, the experiences, the voice of the folks that I work with is integral in my work? So my research is for advocacy. I work with sex workers, for example. I'm not a sex worker. And part of the sex work in South Africa, these are sex workers who use their agency to be able to advocate for the decriminalization of sex work. And so my research is not to serve mere publication, but to amplify their voice and their agenda. And so it becomes so important for how we straddle power, because we also acknowledge in that space that, there's value, there's power that I don't have. I don't have the knowledge and the access for understanding what the lives of sex workers. What I do have is access to space. I have access to particular ways. And so how do I use that access to enable? But more importantly, how do we come to a collective agenda that serves both the interests of me as a researcher, but more importantly, the interest of their advocacy, their reform that they are seeking, and helping them navigate policy spaces, advocacy spaces, to be able to influence change and leverage change. Thanks.
Thank you, Lance. I think a lot of interesting questions and considerations for us all to think about as scholars and researchers at UCSF. I think we are at time, or past time actually, so I'll turn it over to Mike for a conclusion.
Thanks, Lance, again for your insightful comments, and also Sean, I really appreciate your contribution and thoughtful questions to Lance. Apologies, we are over time, but thanks everybody for staying on. I think you'll all agree that this was a rich discussion, and Lance, we're grateful for your insights. The Reimagining Global Health seminar series will resume in January. We have a hiatus for December with the holiday break, but we'll be back. So watch this space or watch your email for more information there. And let me close again by thanking Lance and wishing you a good evening in Cape Town, Lance.
Thanks so much, Mike. I got a lot of chats in the questions on the chat. So what I could do is quickly funnel them through and try and respond to them. But I can also share my lecture notes with a whole lot of examples, concrete examples of the things that I spoke about and spoke to. So if that's helpful to the community.
By all means, share those through and we can disseminate them. We'll also post them to our website. So that would be great, Lance. And you know, with your permission, your slides and your recording will be uploaded to our website, so folks will have access to them there as well.
Great. Thank you so much.
Thank you, everybody. Take care. Have a good day.